Good morning. Okay, I'm going to set a clock because doing this in 15 minutes and 30 seconds is going to be a challenge, but I'm going to pull it off. All right. I think we are slides ahead. Okay. So good morning again to everyone. Thank you for the opportunity to be back here in Shelby County. I was here 2 years ago and have been impressed with the work that you're doing in the county around infant mortality and around maternal and child health, so focusing on children but also focusing on mamas, which is the population I care about. I'm from Nebraska, which is not Kansas, but most people know the Wizard of Oz versus Nebraska, although we have the Oracle, Warren Buffett, but it's nice to feel like I'm back at home. So thank you to Dr. Haushalter, I hope I said it right, and to Leilani Spence, who called me when I got the call. I was so excited to be able to come down here, and also to Mr. Dixon for the invitation and for all of you here today. So the work that I do, I came to be curious about when I was in medical school. And just with transparency, talking about ACE scores, my ACE score is a 6. And it's what you were just talking about, Dr. Stewart, that it's not just predictive because there are protective factors and resilience, and what you talked about, resistance. And what we're all here for today is when you have people who can come in and help and be those protective factors. The reason I stand before you is not just a physician, but a physician and public health practitioner, and the only African American faculty member in my entire college. Thank you. And administrator at the University of Nebraska Medical Center, is because where I came from could have predicted what my outcomes would have been, but it was interventions, it was community-based organizations like churches, and then there were people just like my neighbors who said, baby, I don't care where you came from, it's really about where you're going, and you can do and you can be anything you want to be. And the biggest change for me when we talk about social determinants of health was when I went to a little black boarding school not too far from here in Piney Woods, Mississippi. And so anybody here heard of Piney Woods before? Wonderful. I am a graduate, a proud graduate of the Piney Woods, used to be Country Life School, and it changed my life, because I wouldn't be here had I not had those adults, those protective factors that took me out of my environment in Detroit and really instilled in me who I could be, what I could be, and more importantly, to whom much is given, much is expected. And so I care about mamas and babies, because we represent women, 50% of the population, but we give birth to 100%. Thank you. Healthy mamas have healthy babies who become healthy adults, and that's when we transform our communities and society. So as a doctor, I can't do it all, so I chose that the population I wanted to take care of was going to be women. I had clinic just this past Wednesday, and I had a woman who came in to get a pap test. And we just upgraded, I'm at a federally qualified health center too, we just upgraded our clinic, we got a nice grant, and we have in the room now where I can see what the vital signs are. Before they had to write it on a paper, put it on a computer, and sometimes I never saw it. But this woman came in and she was 48 years old. She looked like me. She came in to get a pap test and she wanted to get a mammogram. But what I noticed that was most concerning was her blood pressure was 198 over 102. And I had my nurse take it again. And I said, can you feel that? And she said, yeah, sometimes when it's high, I just get a little anxious. And I said, well, are you taking anything for it? And she tells me that a couple of years ago, she came in to see a physician, but the way that physician made her feel and got in her face did not make her feel human. And all she did was wrote her a prescription, gave it to her, she filled it, and she said she didn't like the way it made her feel, so she stopped taking it. So for a visit that was supposed to be about gynecologic health, I actually had to have a conversation with this woman about, I believe that vaginal health is a part of holistic health, but with a blood pressure like this, I am more concerned about your stroke risk, your heart attack risk, and we have to do something about your blood pressure. And so the doctoring that I did was actually loving on this woman, listening to her and addressing her concerns. And when she left, she said, "Can I please give you a hug?" And that made a huge difference for me, because my nurses will say, "Dr. Anthony, her last patient's at 4:30, but you're not gonna get out of there before 5:30, because I end up spending that kind of time with my patients. And I know Dr. Davis is that kind of doctor too, because there are very few of us who understand and come from the environments in which our patients come from. And so I can't do what I do without community. I can't do what I do without other organizations and policymakers. Like, to see your mayor here today was phenomenal. And not only was he here, yeah, we can give it up for him. Not only was he here just to show face, he got it. In 3 minutes, what he said, I was like, this man gets it. And I work with people who get paid to do the work, and they don't get it. But this man gets it, so that's a huge blessing to have that kind of policy. But when I went to medical school, every day I learned how terrible my community and people who look like me were. And whatever disease it was, we had it, and we were the worst. But very rarely did they talk about why. And at the end of the day, I realized I have a very photographic memory. I could memorize differential diagnoses, but what I did not have the answers to is, why do I see people who look like me, yet I'm paying almost $275,000 for this 4-year education, and the stuff I'm learning never trickles down to the community in which I came from. And I struggle with that, because when I had to choose what I wanted to do, it was, am I going to live my life solely in a clinic? And I realized I couldn't do that. I was going to have a hybridized life where I would do clinic, which I do on Wednesdays. I wanted to do research, which I do probably about 30% of my time. And then I knew that policy makes a huge difference. So I wanted to be a leader and administrator, where from the top you could change policies that would trickle down, and other people, whether they got it or did not, would have to incorporate it. So for instance, health equity and health disparities has to be a part of all of our curriculum in our courses. And whether you get it or not, our students are going to get it. And that comes from a policy change. So I take you back to medical school, and the one thing that really concerned me, because I knew about ACE scores because I got an MPH, I knew about where I came from, I knew what my health risks were, I knew I was resilient, but there was no data to talk about people like me. But what I did know is that the buck stops with me. That my greatest goal in my life was that I will break generational cycles of poverty and ignorance. I will break generational cycles of children being born into my family out of wedlock, which I'm one of them. And when I learned that with 16 plus years of education, that the risk of when I become pregnant, that my child will not blow out their first birthday candle is higher than women I took care of down in Nashville at Vanderbilt when I was a resident, who never graduated from high school but happened to be white. That was a huge problem for me, and there were no answers. It was, well, we think this and we postulate this, and this may be an issue. 16 years of education, and I do obstetrics. But my risk when I have a child next year, because that's kind of the plan, knowing that, walking around with that stress, as Dr. Jackson was talking about, makes me wonder my ability to truly change outcomes. So these little guys I used to deliver, I don't do anymore. There are great people and colleagues that do it, but it's also a problem that you can look at them and I could ask you lots of questions and you could just tell me based on race. That's a problem in our country. And we've talked today about the social determinants of health, and some of them we can change and we can focus on, and a lot of you do that work. Some of them you can't change, like I just happen to be born into a black, brown, female body, and those are things that I can't change, and even though I probably look younger than 40, I can't change my age either. And then there are others that we sometimes in science try to understand, but it's difficult if you don't come from those environments. And when we talk about making sure we have partnership and having representation from those environments is really, really important, because there are always cultural aspects that you don't get. What was Dr. Davis saying? Do you drive or ride your bike towards the traffic or away from the traffic? and I was just in Houston, and I walked from my hotel to get dinner, and I was walking, and when I came back, I realized the traffic was behind me, and I literally crossed a median and everything to get to the other side so that I could see the traffic coming towards me. And I didn't feel safe until that happened. So you made me think like, oh, is that cultural? My mama did tell me, she did teach me that. So how much of what we do is cultural versus, I still am answering the question, am I supposed to go with the traffic or away from the traffic? I still don't know. But these social determinants of health is really the answer to how we achieve health equity. And it's not easy to do, because as much as we know we shouldn't work in silos, it's actually the infrastructure and the backbone of how we do our organizational work is that we end up working in silos. And even when we try to, what we call cross-fertilize, it's still somewhat in silos, and we'll say we're multidisciplinary because I'm in gynecology and you're a pediatrician and you're in psychiatry and we're working together, so we're multidisciplinary. That's not really multidisciplinary, we're still medicine. Multidisciplinary is how do you get a doctor in the room with somebody who's a bus driver, with someone who's a teacher, and then someone who works in a church. How often do we have teams that look like that? Because everyone has a lot to bring to the table when we're talking about populations. We all know that where you live, work, play, and pray makes a tremendous impact on, and we talk about health because we're in health, but it has an impact on education, has an impact on sexuality, has an impact on you put anything ... behind it, all of this plays a role in it. We talked about ACE scores, and like I said, mine is 6. I won't tell you which ones are positive, but abuse, neglect, and household dysfunction for many of our communities is generational. Long-standing generational trauma that becomes desensitized to not even being trauma. My nephew, who I love, was born 2.5 years ago. His mother's 25 and has 6 children. She has not seen him since he was 4 months old. My brother is 2.5 years younger than I am, and I am the only one out of my 4 siblings who went to college. My brother, unfortunately, has been in and out of the system, so people won't give him a chance. And he's doing the best he can to raise my nephew. And when I think about the ACE scores and the scores he has, I'm consistently saying, what are those protective factors going to be for baby Sterling so that he can live a productive life? We know that it impacts here. The study was done on physical, mental health, and behavior, but I'm pretty sure if you had a much more interdisciplinary team, you would see that it crosses all sectors. But this is what we know that's evidence-based. I love the NPR study, and it's what I give to my patients because it's easy to understand, and you can listen to it, and then you can click, and it'll ask you the questions, and it gives you your score. We talked about the life course perspective, which is really important because where I am today, when you're first born with our children, they have very little control over a lot of things. So whether I was in school, I would go to Piney Woods and they would talk about, they taught us about diet, they taught us about leadership, and I get home, I don't buy the groceries. When I get home, I don't choose what we're eating. It's you're gonna eat what I cooked and you're gonna eat all of it because money don't grow on trees. And if you saw me 2 years ago, I was probably 25 pounds bigger than I am now, but I know some of that's cultural, that where I came from, it was instilled over and over and over. You don't waste food, you're gonna eat all of this food. And I'm thinking, well, nobody told you to make my plate this big. I didn't even want this. But to eat all that food has been programmed from the time I was a child. Breaking that cycle, changing the story is something that I had to conscientiously do to be able to change the way that I eat. When I flew here last night in the airport at Chicago, the only thing open was this pizza place. And they had a vegetarian pizza, they had a salad, but then they had fried pickles and mozzarella sticks. And my brain was like, ooh, pickles and mozzarella sticks. And then it was a Dunkin' Donuts at that Express. Some people like Krispy Kremes. I'm a Dunkin' Donut girl. And it was calling my name. And I had to change the story in my head. And I just kept saying over and over, there is nothing here that tastes as good as healthy, fit, foxy, fun, and feminine feels. And I just said it over and over and over and over. And I got up there and I was like, I'm gonna take the vegetarian 6-inch, because it was tiny, because they didn't have salads when I asked, oh, we don't have any salads tonight. I was like, okay, I'm gonna get that. And then I walked away and I actually celebrated. I have to reprogram my brain that when I make healthy choices, I'm like, yes, you did it, you did it. So it's like, that's a good thing versus what it grew up on and what it was used to eating, because in the first few years of my life experience, I had no control. Then you get to this part where you're about 18, 19, 20, and you start to make your own decisions individually that are influenced by your community and really your workplace. And so where you live, who you're around, really impacts your lifestyle and your behaviors. And when we talk about infant mortality, when we talk about unintended pregnancy, if we start at that area, I'm more like, we need to talk about why people have sex in the first place. We gotta talk about why young folks are choosing or not choosing to have sex in the first place. And until you understand that for your individual community, then all your programs won't necessarily get to the upstream factors as to why these things are occurring. The life course perspective and things that happen over time impact your insurance status, whether you've got a card or you don't, what you're able to eat. It's like, I look at that now and it's gross to me, but when I was younger, or even like 10 years ago, I'd be like, ooh, I want a burger. But I don't eat that anymore. This looks better. It's still not, I don't look at it and I'm like, ooh, can't wait to get a salad, but I'm somewhere in between, so I'm making progress. It also determines who you get to procreate with, have sex with, whether having sex is a choice or a luxury. And taking care of women, I learn things that they tell no one else. And I've learned that being able to have sex is just a choice is indeed a privilege, because there are a lot of women out there who are having sex to survive, and they're not prostitutes. They need dual incomes. They need partners. This man helps take their kids. They might have children. They might have a whole lot of different social issues, that the choice to have sex is not a privilege. It's a choice that's made out of survival. It determines whether you have transportation or not. And basically, at the end of the day, what happens to you over your life course tells you what your skills, your knowledge, and your abilities are to make healthy, informed decisions for you, your family, and people you love. And we all know this, that in this country, it's not equal. Your zip code predicts a lot. It predicts what your life expectancy is. It predicts what some of your outcomes are. And what we've talked about a little bit, which is the social determinant of health, that's always the elephant in the room. And I can talk about it here easily because there's a lot of people who look like me. But when I'm in Nebraska and I use this one about racism, it's this look like, wait a minute, we don't have slavery anymore. And I said, I didn't say slavery, I said racism. They're two completely different things, right? But I love, because this is important, especially for communities who have been oppressed over time. So this conversation has to happen when you're talking about African American communities. The communities that I talk about who were not voluntary immigrants to this country, and that's also our Native communities. And people don't want to talk about it. Equity, I love when they show this one. There's an updated one where it's now, you can't just equally distribute resources. You have to distribute them where they're needed. But the big upstream factors that we're talking about is, why is this fence here anyway? So how do you get rid of the fence? So if you focus on the boxes, you can fix a problem, but this person still will always have the advantage. Whereas if you move the fence, you have equal advantage. And so what are our fences in our communities that we need to make sure are not there? And lastly, I'll just quickly talk on just 5 quick things that I think are important that we usually don't talk about, but things that I incorporate when it comes to infant mortality. Number 1 is I support family planning, Title 10. If you're federally qualified, most centers will have Title 10. Please support that. Our great president is trying to cut Title 10, and Title 10 is always up for reduction. It's really, really important that women can control their fertility and have access. I advocate for new models of prenatal care. Centering a pregnancy in academia has mixed emotions, because the data, and I'm like, the data's great, but I can tell you Whether it saves babies or not, it saves my mamas, it reduces stress, they're happy with it, and it's something that I want to continue to do. If women are showing up, it's important. And so centering, you can find out a lot of places are starting to do it. It's a framework, it has an evidence-based background that you can use, and with all the studies, whether it changed infant mortality or outcomes, the women and their satisfaction in their pregnancy experience consistently, though that data was positive. The last is really in the 21st century, I believe, with all the contraceptive methods that we have, that no baby should be unintended. But that's not the truth, because it's much more complex than that. But I do a lot of work on postpartum contraception. I do a lot of work, like my nurses call me the Depo Queen. I'm really, really huge at being able, every single patient that comes in my office gets a sheet with all the contraceptive options, and I do everything I can to make sure that women are in control of their fertility. The other piece is really important about birth spacing. I am ancient to my family. When my cousin got married at 23 years old, I had a little brother who was the ring bearer, and he looked back at me and he said, "Ain't you older than Crystal?" I said, but I was only 27. He said, "Why come you ain't got no kids or no husband?" And now he says, because I told him next year I'm having a baby, he said, "You too old to have a baby." I said, "Thanks." And of course, the importance of breastfeeding. And I really focus on breast milk. Like, breastfeeding is great, but a lot of my patients, that's not going to work or happen for them. So I really emphasize what's most important is the breast milk. However we get your breast milk is important. And the last that I'll say, how many of you have heard about PrEP for women? Great, the message is getting around. It has to get around even more. I do not have a financial relationship with them. I just know I was blown away when I heard about it, and that Medicaid will cover it. You can check it out if you want to Google it, because I don't have time, but Truvada is basically, they were doing it, it's an HIV prevention medication that you can take every day. And as I said, having sex by choice is a luxury. I have a lot of women out there who are having sex because they need to. They have partners and husbands who cheat on them, that won't use condoms. They're coming in with gonorrhea, chlamydia. I treat you for gonorrhea this month. 3 months later, you got chlamydia and you're married. And you can't leave him because of X, Y, and Z, and he won't put condoms on when he's sleeping with these girls who live in the hood, who are sleeping with, Ray Ray, who just got out of jail. So there are lots of things that are going on, and this is a medication you take once a day that gives women their power back and reduces HIV. So if you haven't heard of it, please look it up. And then the last is, really, we talk about maternal and child health and infant mortality, and there is no maternal and child health without the maternal. There is no infant mortality without the mom. And when I talk to moms and I do this work, a lot of times they talk about how they feel left out, how all you really care about is my child, but nobody cares about me. And making sure that we have equal efforts to care for women who are the mothers, because momentum happens and starts with mom too. And so I will end with that. And one size doesn't fit. And this is my soul work. I'm going to change the world. That's what I do. And never forget that a group of small, committed citizens can. It's the only thing that ever has. And I love what JFK says. I'll let you read that because I want to give time to my colleague. And that's my nephew. That's baby Sterling. And I don't care that his ACE scores are going to probably be over 6.2, but he's going to be just fine. Just fine. Thank you.